Hello, hi, and welcome back to my channel. ഏവർക്കും എൻ്റെ ചാനലിലേക്ക് സ്വാഗതം. So this is a part 4th session for Prometric. I have done 3 sessions for Prometric. Those who have not yet watched have a watch to part 1, 2 and 3. So this is the continuation of the part 3 session. So let us begin today's session, that is part 4 session for Prometric. Moving on to the 31st question. Investigation of choice in choledocholithiasis. Option A CT, option B PET scan, that is positron emission tomography scan, option C is ultrasonography, and option D is MRCP, that is magnetic resonance cholangiopancreatography. The answer is option D, MRCP, that is magnetic resonance cholangiopancreatography. So now let's see the explanation. A hardened deposit within the fluid in the gallbladder, a small organ under the liver. Gallstones are hardened deposits of digestive fluid. Moving on to the next question, question number 35. Investigation of choice for deep vein thrombosis is option A USG ultrasound, option B angiography, option C CT scan, and option D is MRI. So the answer is option A Doppler ultrasound. So it is the best choice of investigation for deep vein thrombosis. Now let's see the explanation. Doppler ultrasound is an imaging test that uses ultrasound to look at the flow of blood in the veins. It can detect blockages or the blood clot in the deep veins. It is a standard imaging test to diagnose deep vein thrombosis, that is DVT. Moving on to the next question, question number 36. An 8-year-old child was injected contrast in hand for CT chest, that is contrast enhanced computed tomography. Immediately he developed swelling in the arm which gradually increased. After 4 hours, there was numbness and pain, and he was not allowing the doctor to flex the hand. Pulse is present. What should be done? Option A, high dose prednisolone. Option B, arterial thrombectomy. Option C, immediate fasciostomy. And option D, angiography. The answer is option C, immediate fasciostomy. So fasciostomy is a procedure in which the fascia is cut to relieve pressure in the muscle compartment, and it is used to treat people with acute or chronic compartment syndrome. Before the procedure, the doctor administered general or regional anesthesia. Moving on to the next question, question number 37. A radionuclide scan done for parathyroid adenoma is option A system EP, option B iodine 123 scan, option C technetium 99M sulfur colloid, option D gallium scan. The answer is option A system EP. A system EP parathyroid scan is a procedure in nuclear medicine which is performed to localize parathyroid adenoma which causes hyperparathyroidism. Adequate localization of parathyroid adenoma allows the surgeon to use a minimally invasive surgical procedure. Moving on to next question. Use of water-soluble contrast medium is option A constipation, option B perforation, option C ileocecal tuberculosis, and option D gastroesophageal reflux. Usually we are using water soluble contrast medium if the patient is having perforation. So the answer is option B perforation in the case of barium studies. Usually this water soluble contrast medium is used. Moving on to the next question, question number 39. Which of the following liver metastasis appears hypoechoic on ultrasound? So there are 3 echogenicities in ultrasound, that is anechoic, hypoechoic, hyperechoic. Now let's see the options. Option A breast cancer, option B colon cancer, option C rectal cancer, and option D mucinous adenocarcinoma. So which of the following liver metastasis appears hypoechoic. So the answer is option C, rectal cancer. As I said, in ultrasonography, there is three echogenities, that is hypoechoic, hyperechoic as well as anechoic. In the case of abdomen scan, the bladder appears as anechoic since the bladder is full of fluid, that is, it will be filled with urine. So it will appear as anechoic. So hypoechoic means this term means not many echoes. These areas appear dark gray because they don't send back a lot of ultrasound. Solid masses of dense tissue are hypoechoic, and the calculus appears as hyperechoic. Calculus means stone. Moving on to the next question, question number 40. X-ray artifact is option A radiolucent area, option B any abnormal opacity in the radiograph, option C produced when patient moves while taking the shot, and option D any of the above. The answer is option C, produced when patient moves while taking the shoot. Moving on to the next question, question number 41. Decubitus view is useful in diagnosing. Option A pleural effusion, option B pleural effusion with dependent hemithorax, option C pericardial effusion, and option D middle lobe consolidation. So usually the decubitus view, if the patient is lying on either side, is known as a decubitus view. If the patient is lying on the right side, then it will be called as right decubitus, right lateral decubitus. And if the patient is lying on the left side, it is called as left lateral decubitus. So usually this decubitus or the lateral view is usually for diagnosing the fluid level. So the answer is option B, pleural effusion with dependent hemithorax. So what is meant by pleural effusion? So now let's see the explanation. A buildup of fluid between the tissues that line the lung and the chest. Fluid can accumulate around the lung due to poor pumping by the heart or by inflammation. Moving into the next question, question number 42. Grid is a device used for option A reduce scatter radiation, option B reducing the patient's exposure time, option C reducing the contrast of the X-ray, and option D all of the above. The answer is option A reduced scatter radiation. So grids are used to reduce the scatter radiation, and it is named by the scientist, that is Gustav Bucky. So with that, grid is otherwise known as Bucky. While using the grid, the patient dose will be high, but thereby reducing the scatter radiation. Moving on to the next question, question number 43. The active ingredient of X-ray film is option A silver chloride, option B silver bromide, option C silver nitrate, and option D gold chloride. The answer is option B, silver bromide. It is a widely accepted ingredient in X-ray film. The emulsion layer. The X-ray film comprises of four layers. That is base. Base is a supporting medium for all the layers. Then comes the supercoat, which acts as a protective layer. Adhesive layer, which sticks the base with the emulsion layer, and the main layer of the X-ray film is the emulsion layer, and it is formed of silver halide crystal along with gelatin. Moving on to the next question, question number 44. Which of the following technique uses piezoelectric effect? Option A MR spectroscopy, option B zero radiography, option C ultrasonography, and option D conventional tomography. The answer is option C, ultrasonography. So the basic principle of ultrasonography is piezoelectric effect. With that, I'm winding up today's session. Hope you all are clear with today's session. If you have any suggestions or if you have any areas to be included, you can just WhatsApp me. I'll be giving my WhatsApp number as well as my email address in the description box. You can also join my app. Those who wish to join my app can also WhatsApp me. I'll be giving my WhatsApp number in my description box as well as a link in the description box. So with that, I'm winding up today's session. Stay tuned till next Sunday. Sunday is the day I used to upload new videos. Until then, stay safe, stay healthy, and stay tuned.